excited to bring you the third session of the Fireside Chat Tech Series. So in our previous chat, panelists opined that data is gold, data is king. I also mentioned that probably data is the new oil. So we decided that the topic of today could be circling around data. So we've decided to have the topic as importance of data in the pharmacy world. Healthcare world wants to drive value out of data. So value-driven healthcare is something everyone seems to be working towards, not just individual, but companies as well. For example, a pharmacy company, rather than focusing on selling drugs, which used to be their regular business, today they are trying to find efficacy of drugs and also prove a point, right? Forget about humans or companies. Even machines seems to be doing more than what they're supposed to be doing. So last week I was part of a large rural outreach program. I was amazed to see that a microscope-based machine, which is used to let doctors look into the eyes of a patient to detect a diabetic retinopathy, was so intelligent and value-based that it was aiding doctors in pinpointing probable areas of damage so that the doctor could be more effective. So this is nothing but what we call as edge computing. Also, you can call it as augmented intelligence because a machine is helping doctor to be more effective. So people also say that artificial intelligence can be applied to nearly every aspect of a pharmaceutical and healthcare industry to enhance the data processing. So today there are machines operating people, and there are many software programs which are used to better population health. So I would say technology is at its best, isn't it? So people will surely agree with me when I say this is the fastest pace of technology's development that we have ever witnessed in our lives. But suddenly, pandemic seems to have taught us that we are nowhere near where we should have been, and we still have a lot more to do. So even though this is the fastest pace of technology's development that we have ever witnessed in our lives, I'll be more than happy to say that this will be the slowest we will witness for rest of our lives. And if I say this, it'll be not wrong at all. So there's still a lot to do. When there's so much of technology is available, it surely can be a miracle if projects succeed. There's so many options in front of us. For us to do it right, it is always good to hear from people who've been there and who have done it. That's probably the best way to pick a technology. So in today's session, we shall talk to an expert from PBM Industry who will share his thoughts on importance of data in today's changing world. We will also discuss how organizations are leveraging data as part of their growth strategy to service their customers better. So please join me in welcoming our speaker today. With total 25 years of professional experience, Sanjay, an IT executive, has been leading globally spread teams to develop world-class business applications and transform technology operations. His professional experience spans over big tech, communication, net tech, e-commerce, and healthcare industries. He currently works at MedImpact Direct, a San Diego-based healthcare company that makes home delivery of maintenance medications and access to specialty medications easy. As a VP of Product and Technology, he leads all aspects of product design, development, and technology support while working closely with business partners to develop product and service offering strategies. At his current role, he has also started and has been leading data analytics initiatives, translating facts into knowledge and value add. Warm welcome to you, Sanjay.
Thank you, Shruti. Glad to be here.
Thank you. So for audience, please post if you have any questions in the Q&A section, and we will take up your questions in the later part of the session. So Sanjay, since we've been talking about data, and you have been working on data for many years, and you're an expert in handling data, especially for the pharma, PBM, and pharmacy industry. So my first question to you would be relating to data. So over past few years, data has gained a lot of importance in general and especially in healthcare service delivery ambit. So can you talk about your personal experience in how the role of data has changed in the recent years and how it has impacted the organization's strategic direction or approach?
Totally, right. So, irrespective of the industry, as you say, the data is all about first defining the what and then finding out the why behind the what, right? And continuing to where you left off when you were calling it the data is king, right?
Yeah.
I actually came across an interesting statement as I was reading an article by Scott Smister from CIO Mastermind, and I'm definitely paraphrasing it. He says that if the data is king, the use of data is the queen, right? Who knows all the strategic move of why, whether, and how, right? And I found that statement amusingly true. Amusing part you can understand that why it's amusing, but the true, let's actually analyze this statement in the with the lens of what we call as a knowledge pyramid, right? Or some people call it a DIKW model. So picture a pyramid in your head, and the very base layer is data,
Mhm.
right? And the data alone is just a pure fact, has no context, and absolutely bears no meaning, right? So people can say, like, for example, if you give an engineer and say that, hey, here is a 5 GB of log file, go and figure out what the problem is. It makes absolutely zero sense. Now, when you put the context with the relevance to set number of people, that data actually converts into information, right? And that's where you are kind of applying the relevance, and you are finding out what, who, and when, right? So that's another layer sitting on the top of data, which we call as information. Now, when you apply how on that information, right? Because you had the data, you applied the context, you gave it to the right set of people who figured out all the questions about what, who, when, and now they are trying to apply the how. How can be anything, whether you are addressing a risk, you are fixing a problem, you are exploiting an opportunity, or you are actually just improving your process, right? So, and this is where the biggest differentiation factor comes in, because it's a cognition through your experience, and that's what differentiates you in the market. And this is the layer that we call as a knowledge, right? And knowledge kind of differentiates you, and you understand the different data sources that you are dealing with, and you know what to do with and how to do it. Then on the top of that, when you take it to the top level, you understand the what and why behind it. And that's what I said, that data is all about defining the what and understanding the why behind the what. And it kind of makes sense what Scott says, that if data is king, the use of data is the queen, who knows all the strategic moves, right? So, and this is exactly comes back to your point. So if you look at this DIKW model, at the top sits the wisdom, which actually tells you that what new market you need to explore, what new opportunity you need to exploit, right? So now understanding what this data and this knowledge pyramid is all about, now let's actually translate that into the healthcare industry. And just to understand the impact of every single action or inaction. And I very boldly highlight the fact that inaction also, because if you are not taking any action on the gold mine, which is called data that you are sitting on top of, you are losing big time, right? Because if I again go back to the DIKW model, data and information is kind of giving you the historical perspective, right? Knowledge is about what to do now, but the wisdom is about defining the future strategies. So that's where if you are not taking any action on the data that you have at your position, you are losing big time. Now, converting that statement into the healthcare industry, I was just reading a report from CMS, which is Center for Medicare and Medicaid Services, that the audiences can learn more about just going to the cms.gov. So there they published their NHE projection, NHE what they call as a National Health Expenditures. So all the expenses under healthcare, right? So they were projecting, actually they published their projection for every decade. So that's the decade that they covered from 2019 to 2028, right? So their projection that tells that it's going to grow, this NHE is going to grow at the annual average rate of 5.4%. Let me throw a question. Do you want to make a guess that what that dollar amount is going to be in 2028? So
No.
$6.2 trillion.
Wow.
right? So that kind of gives you the impact, and this is where your action and inaction kind of becomes very important,
Mhm.
right? And one more thing to note, as you were saying that this whole pandemic and all that, this projection was made pre-pandemic. And we all know that how strange that year 2020 was, as they say that we will never look at the phrase hindsight is 2020 the same way ever again in our lifetime, right?
Yeah.
So when in 2021 things are rebounding, that 6.2 trillion is going to be a much larger number for that decade. So that kind of tells you the overall financial impact in the healthcare industry. So now actually let's bring it down to I'm going to just take two very basic use case, right? That how the data can help. So in the pharmacy world, let's say we have a call center where we are helping hundreds and thousands of patients on an everyday basis, right? Our call center performance, there are two key metrics that, among several other, that the two key metrics that we track is ASA and AHT, average speed of answering and the average handle time, right? So in a typical pharmacy world, if an order comes in, an order can have one or multiple prescriptions. It goes through multiple that we call as a internally that we call as a multiple queues, right? If it's a clean prescription, mean it doesn't need any follow-up, any prioritization, anything. It just goes and directly hits the fulfillment chain and then off it goes for the shipment. However, if the order is not clean, maybe an order has multiple prescription and two prescription happens to have some problem, then you kind of put that in a different queue where you are splitting that order into multiple orders, right? So in a typical day in a call center, if I'm a call center supervisor, I would need the information that how my each key call volume is doing, right? Normal way, one of your call center staff is running and screaming, coming to your office and say, hey, we have a problem. That's one way to solve it, right? But the second way, you have the historical data, right? Because I was just looking at our own dashboard, like there are 1.8 million record that we have till date today for the year only, right? That 1.8 million record is telling me something that I can actually put in use. And ultimate goal is the patient safety and the patient quality of life, meaning that we are giving the drug to the patient at the right time,
Mhm.
at the right cost, right? And more importantly, the right drug. So just build a dashboard, and it's a kind of very nice heat map that actually tells a particular set of hours in a day that which call volume gets the highest number of call, right? Or the highest number of work backlog, if you will, right? So your supervisor has that information right in front of them. And on the top of that, they have kind of defined their thresholds that if the backlog goes above a threshold, then it automatically turns red. And imagine you have a dashboard right in front of you that's helping you to make the decision proactively, right? And ultimately, imagine who you are impacting. Ultimately, you are impacting a patient who needs the right drug at the right time.
Yeah.
Second thing, in a typical pharmacy world or in any healthcare vertical that you pick, you are not doing your business alone. You are definitely dealing with a lot of vendors, right? And at the end of the day, your reputation is at stake because you have signed the SLAs and the performance guarantees that we call as the PGs, right? But for you to meet your SLAs and PG, you have the heavy reliance on your vendors who we are dealing with, who are the part of your critical workflow. Now imagine like you are having a problem or you are seeing a trend and you are picking up the phone and calling your vendor and are talking out of the gut feel. Doesn't work that way, right? Or if you need data, you are looking at your IT team. Can you pull me the data for that duration? And by the time IT prioritizes and gets it done and puts it in front of the person, that person has already moved on because he had to manage the entire operation. He's just not going to wait for your report, right? So imagine that you are providing all that report right in front of them on their fingertips, and they are having the conversation with the vendor, looking at the data and being going down to a precision level of every single prescription, right? So accountability, speed of business, and ultimately helping the patient in the right time. These are the just very two very basic example that how you can turn the data to your benefit, right? And again, remember that, keep that $6.2 trillion in your mind,
Yes.
because you are making some difference in that amount, right? Whether you are saving your client or whether you are putting that in your own pocket.
Yes, I prefer the second one probably. That's a lot of
Right.
money. Thank you, Sanjay. Quite
Sure.
interesting answer to the first question. So I like the one that usage of data is queen. So very nice, and also the DIKW model. So I was new to this, so that's a good learning for me from this question. Thank you. So now that we've seen what kind of impact that it has on the organization strategy and also what we are trying to do today, my next question would be somewhat relevant to that. Maybe you have answered some of those in from the previous question. So the question is, many healthcare companies are investing heavily in data initiatives, but failing to explore its full potential, right? So, what are some of the typical challenges that organizations face in building the data ecosystem that is all inclusive and making it accessible for appropriate decision making? So, what are the prerequisites and essential components to consider in defining and implementing such a data strategy? That's my question.
Okay, good question. So again, going back to your opening statement, that the technology has advanced a lot, right? And especially the technology that once appeared to be a very sophisticated technology available to only few set of technologically elite people, if you will, right? They have just become the commodity now. You have a lot of tools to play with. So at this point, fortunately, again, referring to your point, fortunately, we are not limited by the technology, especially in the healthcare industry, right? Or not especially in the healthcare industry, but technology is available. It's a commodity, right? Once this AI and ML or all of the sophisticated technology, they used to be kind of a thing of like companies like IBM, if you will, like that. When the IBM Watson came in, and if you are trying to implement IBM Watson in your company, you have to have a very, very deep pocket to make that happen, right? So technology, fortunately, is not the limiting factor. What the limiting factor, personally, in my experience, is the data, right? Because it kind of takes me back to when I was working in the ed tech industry. You want to track a researcher's and his work, his or her work throughout the lifetime, right? You want to know that what grant that researchers was allotted, what kind of research paper they published, what was the impact of their research and all that. But the research is kind of changing the companies or changing the organization, so you lose track of it and you have very fragmented information. This is a very great analogy that what kind of challenges we are seeing in the healthcare as well. What I mean by that, as a patient, I can change my prescriber. I have no intention or I have no constraint to be stuck with only one pharmacy. I can change my pharmacies, right? I can change my hospital. I can change my healthcare specialist. So when I'm making all these changes, every different entity, they are kind of capturing my data, right? And this is where we lose track of the overall healthcare information for every single individual, because at the end, see, whatever we do, we have to put the patient safety, patient security, and the quality of life at the center. And this is what I see a big problem. Let's say if I'm a PBM, yeah, I have all the data about the claims. I know what drug was delivered to which patient, coming from which prescriber, and what health plan they have. That's it. What hospital they went to, how many ER visit they have, how many hospitalization they have, how many hospital readmission they had, what was their path lab report, what is their histology report. No information, right? So this is the big problem, like creating an ecosystem, bringing the right partner in your data journey who actually own that data. Is there a centralized data clearing house? I don't know, right? So the key is how effectively you can build a 360-degree picture around a patient to provide the right treatment at the right cost. Again, it goes back to the patient quality of life and that NHE projection for that decade, right? Now imagine you have access to health plan, you have access to PBM, you have access to pharmacies, and you have access to EHR data. Imagine the powerful analytics that you can create, again, focusing on the patient's quality of life. So this is where I see the problem, and whoever is in the healthcare industry, and it's a complex problem to solve. I'm not saying that there is a solution out there, right? But I think that right now there are a lot of great partners that you can pick, a lot of great technologies that you can pick. Cloud is becoming more and more of a kind of norm in the healthcare industry because there have been a lot of improvements. So technology-wise, there is not limitation. I think that what I see is a clear vision as an organization that what exactly you want to do, because that's another problem that data can pose in front of you because the data is everywhere, right? Your big challenge is to filtering the noise from the data, and that filtering the noise from the data is going to stem from your own strategy. That what exactly the initiative you are behind, right? So how can you partner with other key players in the industry to build a common vision? Because it has to be a common vision. Let's say you hold part of the data, I hold the part of the data. Your and my vision should match, right? For us to partner and then say, hey, this is the problem we're going to solve, or this is the opportunity we're going to exploit. So that's what I see. I don't see a technology being a problem or any kind of hindrance or constraints or limitation to the data world when it comes to healthcare. Does it answer your question?
Yes, you did. There were quite a few points that I picked from there. Having a clear vision, clearing out the noise, building the 360-degree picture around patient, that's the very important aspect. And one of the biggest thing that you mentioned that I've been thinking about it for quite some time is when you said we have to know what researchers are doing today. The reason is when we had such big problems in healthcare, which had to be solved many, many years ago, when they first built supercomputers, the researchers took use case of letting the AI programs play chess against Gary Kasparov, and they spent 10 years on that.
Yeah.
So, so I was always thinking on a lighter note, right? I was always thinking they could have surely found a better case, a use case. So thank you so
Hey,
much.
that was the least risky use case, so why not?
Yes, I agree. Thank you so much. So, but that was on how companies are implementing the data strategy. The next question would be on the data life cycle. So, can you briefly talk about the data life cycle management journey and what are the major objectives and use cases to focus upon?
Yeah, data, especially in the healthcare world, it becomes very interesting. And just piggybacking on the last question, when you're starting with the data lifecycle creation, right? You might not have all the data created within your own ecosystem if you're partnering with some other data provider. So the data is being ingested, but that also falls in your domain. That also falls in the data creation vertical, right? When you're talking about the data lifecycle. Storage is another interesting problem because, like I said, any business not in healthcare, they do not have time to wait, right? So whatever the data you are putting in your data analytics, you want to keep it closest to the source because the farther the data moves from the source, longer it's going to take to generate the value for the business, right? So there has to be a data storage, well-defined strategies that where your data is going to reside, your primary, your DRs, right? And whether you're going to create a different read-write instances so that when you are actually processing and analyzing your data, it's not going to actually impact your main application set of applications. Uh, Usage, you are definitely providing a lot of usage of the data, whether it's serving the patient, it's serving the internal stakeholders, it's serving the decision makers, right? Archival and destruction, and the last two sector of this data lifecycle, it becomes very interesting, especially in the healthcare, right? Because I can speak for healthcare. As a healthcare organization, you have to have your what we call as a record retention schedule or the destruction procedures, right? Very well defined. very well defined, read, and understood by your almost your entire organization, right? And this is where you can come up with your own retention schedule or the destruction process and procedures. However, in healthcare, you have to comply with a lot of rules and regulations. Let's say if I just don't want any data after 5 years, I cannot, right? Because I'm supposed to retain the data at least for 7 to 10 years when it comes to the PHI, right? Your finance data, right? For the auditors, once your 5 years, I'm just making it up, I don't know because what are the exact numbers, but the finance, your auditors might want your 6 year old data, right? So because of all that, in an organization, you cannot just simply very be focused only on the PHI. You have to consider your internal data, you have to consider your finance data, your accounting data, your sales data. So for that, and you as being a data team, you are responsible and accountable to all of them. And you want to make sure that when you are putting your architecture and the design pattern in place, you are considering all those record retention and destruction procedures and policies in place. Because let's say if you completely ignored it and you moved on and you built something and somebody happens to find a data which is 10-year-old, you are in trouble because you are not supposed to have that data available. Or if somebody is needing the data which is 6 year old and you have a big, long drawn data retrieval process, again, it goes back to the speed of the business and speed of providing the information, right? One more thing which becomes very important because when we talk about the data, especially in the healthcare, people always talk about the data. This is stored somewhere in the file or in a database, or I ingest it from other entities. What about the facts that you received? What about your email? What about the meeting notes in the whiteboarding session that you just had? What happens to that data? What is their lifetime? What is the usage of that unstructured data in your data analytics or the dashboard that you are building, right? So I would say that if I have to summarize my answer, I think creation, storage, and usage, a lot of organizations are pretty much used to it. But archival and destruction, this is where you want to bring your compliance team very early on in the game. So when you are building your database, your BI architecture or the data modeling, you have all those information and you have a very trusted partner who can guide you to put the right design in place. I'm not sure whether that answers your question.
Thank you so much. Thanks for that. So my next question would be, if while answering the previous one, you also mentioned that the data need not be in your ecosystem. Some data could be external to your organization and it need not be the structured data, right? So while most of the organizations typically have data ecosystems around supporting clinical, administrative, and financial data, like you mentioned, the role of social data and patient generated health data, it could be a completely hyper personalized data, is increasingly becoming important and relevant. So how, in your point of view, does the addition of a non-traditional data source impact the data strategy?
Excellent. So good question though, because a lot of things are happening in the social platform nowadays. So
Yes.
let's talk about the social data first. Uh, in my personal opinion, that the social data, I think that it can be used just to gauge the early trends. Because see, when we are talking about the healthcare, we are talking about someone's life. And social data, at least as of now, it's not a kind of trusted slash, I won't say trusted, just the validated data that you can actually directly put as is in your healthcare strategies, right? However, it's a really great platform to identify the early trends, right? And because there are a lot, not a lot, almost all the organizations, they have their own social accounts, right? So what kind of information, what kind of early preview of their upcoming guideline they are posting so that you can be ready. People are creating the special interest group based on a problem or opportunity or a process improvement, right? So you definitely need to put that in your ecosystem, especially when you're talking about the data creation, right? One good thing that it's an excellent example that just came to my mind. Early this year, we had a big problem with the USPS delivery schedule. right? Because of all the pandemic, they had such a big workload that the packages were being delayed.
Mhm.
Now, put that in terms of a pharmacy business who is actually heavily relying on those couriers to deliver the prescription to the right time, at the right time to the patients. Now, remember, if we had this social platform and we start hearing the early rumbling that, hey, there might be a problem looming on the horizon for with the USPS delivery, we as an organization could have been way more proactive, right? Rather than having a patient picking up the phone and calling that where my prescription is and all that. So this is where I can definitely see the social platform is going to help getting the early trend and whatever the other processes that you have to support your entire offering for you to be more proactive, right? Because social platform is definitely a great avenue to see the early trends so that you can actually, if nothing else, at least you can warm up. And there are, especially in the healthcare and the pharmacy industry, like we have a lot of organizations like NCPDP, NCCN. Well, like NCPDP is like you might know already, National Council for Prescription Drug Programs. NCCN is something that I learned very recently about this National Comprehensive Cancer Network. They are defining the guideline even down to the software tools and defining the standards. So what they are talking about in just the data from their social platform, what they are talking about, what might be coming, right? Are they making any changes to the guidelines or any update? Because these things are happening on a very regular basis. Now, the second thing you talked about, this PGS data, like patient generated data, health data, it is very important and very key. Right? And the reason I say it, especially when you're talking about the specialty drug, when the patient is being treated for a very critical illness, this patient generated data is very critical in improving their overall quality of life, or for the lack of the better word, like for the therapeutic watch for that patient, right? Uh, mm, and patient generated health data could be from hospitals EHR, where somebody is visiting doctor and doctors are taking notes as they are having conversation with that's what, or the pharmacies who are closely working with the patient, they are conducting their validated surveys. So that's actually patient provided validated data, which very well can be taken with all seriousness into your ecosystem to improve the overall service to the patient. And while you are doing with this, right, you are dealing with, let's say, if you are coordinating with EHR, you are coordinating the different data platforms and all that, you need standards. You cannot just simply build the plug and plugins to every single data source that you are receiving the data from. And this is where you might have also caused the heat of it, like the Standard Development Organization would be Health Level 7, which we also dearly call as HL7. They have been working in developing and upgrading the FHIR standard, right? Let me see if I get it right. It's called the Fast Health Interoperability
Yes.
Resources, something like that, right?
FH.
So FHIR is becoming more and more common because it again goes back to who you partner with in your data journey. When you are
Yes.
partnering with your data journey, it means that you are ingesting the data from different data sources. So you need a standard. So adoption of this FHIR standard is becoming a norm, and this is where this is going to help. So summarizing, social data, at least in my personal opinion, is to just to gauge the early trend. PHG data is real gold mine. PHG data you definitely want to consider.
Thank you so much. And I'm sure most of these standards are accepted worldwide because that was one of the questions from audience. So it is
Yeah.
becoming many countries are accepting HL7, HIPAA, and FHIR standards as
Yeah,
part
and
of.
I think that whoever in the audience is interested in learning more, just go to healthit.gov. They have plethora of information
Yeah.
and read about FHIR. It's spelled as FHIR. So there's a ton of information and a lot is happening because it just started in 2012, and they claim that they are still developing and upgrading those standards.
Thanks on that, Sanjay. it's very interesting to see how hyper-personalized data is being used. So we've been working on neurodegenerative diseases like Parkinson's and dementia, coming up with algorithms to support researchers. And we had built data lake, and then we had built operational data store also, which was more structured. But then we figured out that even though we thought we were going to use ODS, interestingly, the amount of data that we were fetching from data lake where we had unstructured data, because one of the key information that researchers wanted was for treating Parkinson's, for research on Parkinson's, is how much amount of pesticides were used in that specific district, how much of herbicides were used, what was the pollution levels in those areas, and they were trying to figure out how dopamine got reduced because of all these things. So you never know from where you may want to fetch the data from. So thanks so much. Very interesting answer. So I have one last question before we go to the questions from the audience. So the question is, pandemic has driven adoption of AI ML in the healthcare world and seemingly is here to stay. What has been your thought process in leveraging advancements of artificial intelligence and machine learning technology, and what business areas you think can drive benefit from this?
Nice. The buzzwords I start coming in. Good question. So, for especially for this question, let's actually focus on the specialty medications, right? Because this is where the real usage of AI and ML. And when we actually jump into the specialty medication, let's actually again look at the impact. So recall that $6.2 trillion again, right? The basic anecdotal information is that less than 2% of the US population utilize these specialty drugs.
Mhm.
However, 51% of the total drug spend is for the specialty drug only. You can imagine several $100 billion industry that we are talking about, right? Now, actually, let me put out few data points and then we can connect and actually see where and how it can help. As you know that, as you are also talking about from your experience, healthcare is also becoming more and more digital. Right? What does that mean? We are generating more and more data. And as we said in the beginning, data alone with no context and no relevance absolutely bears no meaning. That's one data point. Another data point, coincidentally, actually, I was reading a PwC report that they published early this year, and they were saying, see, the digital adoption, it has to have some solid basis. So in the report that PwC talks about that more and more clinicians are agreeing that this non-traditional venue of healthcare are not only maintaining but also improving the overall health outcome. That's another data point. So not only patients, but the doctors and the specialists and the clinicians are also becoming comfortable and confident on the offering of this non-traditional venues of healthcare. Thirdly, there was another report, I don't know where I read, but I know that it was the researchers from Humana. They published a research paper. And again, I'm going to refer back to the 6.28 trillion by 2028. Humana actually identifies at 25%, one full quarter of the healthcare spending categorized as waste. Right? So when you are standing in front of your client and saying, this is what I can offer, imagine you're just simply saving them 1 or 2% of that 25% of wastage. Big money, right? And they actually define that waste as something like administrative complexity, unnecessary treatment, hospital readmissions, or the ER visit, or what have you. So there are a lot of things that they combine as they call as a waste. And they call it a waste because if we would have done good enough analysis looking at the historical data and suggested, I won't say recommend because recommendation coming from a machine, especially in the healthcare right now, is a pretty big word. I would say actually the solid reference engine. that the experts or the clinician can refer back and actually recommend the prescription. Imagine if that would have already done, how much money they would save. Right now, let's actually combine these 3 points. A lot of data is being generated. People are becoming more and more confident with the non-traditional venues. 25% is a complete waste. Now, you are kind of collecting all this data. You are collecting the data from PBM, you are collecting the data from EHR, you are collecting the data from pharmacies or other validated surveys and all that. And you are building a therapeutic watch, right? Therapeutic watch is about like looking at the complete 360-degree picture for a patient and actually providing the proactive, predictive recommendations, right? So this is where you're going to actually address the wastage big time. You are seeing the trend early on and you are actually recommending. And pharmacogenomics is becoming another big avenue, like where, as they say in the traditional world, we used to say, right, the no two human are alike. We are taking that statement seriously down to the gene level.
Yeah.
And if we are saying that no two humans are alike, there are higher chances that the same drug is not going to work for both the patients in the same way for the same disease even,
Yes.
right? So you are getting a ton of data from the pharmacogenomics industry vertical as well, where they're saying that, hey, this is the patient, that's what the gene is telling, this drug is not going to work. Why don't you try this drug? And now, if you have, yeah, as a prescriber, if I have all that information at my disposal early on, a faster recovery to the patient, a better patient health life quality, and a ton and ton of money saving. All right. You cannot do that with the traditional technology. You have to have the smart algorithm. You have to have the smart machines who are actually collecting these hundreds and thousands of data point and actually making a recommendation on the fly and presenting in a golden platter in front of your prescriber and saying, hey, I think this is what you should do. All right. So this is where the AI and ML, as you were saying, that looking at the eyes, they can tell that what's the diabetic level. This is what we are talking about, and this is not possible with the traditional technology. And actually, there is a one company that I know here in San Diego, and I'm not going to go into much detail about that company, but this is exactly what they were doing. They are nothing but just the team of PhDs in artificial intelligence and machine learning. The 50 to 70% of the company was the PhDs who their whole job was writing algorithms, right? So what they were doing, they were actually doing exactly the same thing. They were collecting the data point for whoever they can lay their hands on and creating this smart algorithm and selling it to the prescriber's office as a service. And the doctors just have to do few clicks for that particular patient that's sitting in front of the prescriber, and voila, there you have the recommendation right in front of you. You don't have to take it because you have to apply your own critical thinking as a doctor, but you have that immense power. Like for the lawyers, right, if they get a very typical case, they refer back to the old book, that what happened in that similar case. So here the smart machine is giving you all this information with real time. This is the use of AI and ML in healthcare.
Fantastic. I think the best way to pocket that money is to build a couple of machine learning programs. So that might help us. Anyway,
If
thank
it,
you for that. We have one question from audience that we can take. We are running out of time. So my question will be on hosting healthcare data on cloud. So what's your opinion on that?
yeah, as I was kind of alluding to that point as well, lot of cloud data providers are becoming more and more sophisticated. What I mean by that, they are they are willing to partner with you. What I mean by that, they are willing to sign your business associate agreement where they have the shared responsibility to protect your data. So to address this so-called concerns, whenever we hear the cloud word in healthcare, bring your information security, bring your compliance department or the expert very early on in the game. Make sure your cloud provider has served other client in the healthcare industry. Make sure your cloud provider can provide you the HIPAA compliant instances. right, to host your data. And it also comes back to that, make sure that they are willing to sign your business associate agreement, right, to take the shared responsibility of protecting your data. And you can again come down to it. Maybe there are too many contractual and the legal obligations that you have to meet. Like, what if your contractual obligation says that nobody outside the US soil can access your PHI? So grill your vendors and make sure that even though they are just simply providing the 24/7 support, none of the support call is picked up by someone outside US. So, and the companies know that if they have to really play in this healthcare vertical, they have to comply with all those rules and regulation, and they are kind of becoming more and more sophisticated and more open to address all those pain points.
Fantastic. Thank you. Thanks, Sanjay. I think we are running out of time. There are more questions from the audience. So we have noted down the questions and we will respond to the audience back with our answers. So thank you so much for your time today. It was an extremely interesting discussion and there are a lot of takeaways for me from here. Thank you for your time spending with all of us.
Sure. Thanks for having me. It was fun talking about the healthcare.
Thank you.